Good evening. I'm a few minutes late. I'm sorry about that. I apologise. I was having. I'm just going to tag some people in to this live video. Bear with me. That'll do. Okay. So I wanted to come on to my group page tonight because I wanted to answer any questions that anyone has about botox and about, well, it's botulinum toxin really, and there are several different brands, and if you have any questions about where you can have botox, how it works, what the side effects might be, what might mean you can or can't. Hello Donna, how are you doing? Anything at all related to botox in the upper face. So this is the upper face, the upper third, from around the eyes, between the eyebrows and the forehead. So botox is a brand name for botulinum toxin, and botulinum toxin has other brands as well. So it comes in Dysport, Botox, Azalure, and obviously Botox. So the different brands mean that they have different protein complexes in them, or complexing proteins. Botulinum doesn't have any complexing proteins in it at all, and so that's the one that I tend to use first for my patients, because without any proteins in it, the theory is that there's less likely to have any adverse events and to build up any kind of immunity to the Botox. So Botox can be administered in the face, and the standard treatment that people tend to have is between the eyebrows, across the forehead and around the eyes. You can have it in other areas of the face. So for example, if your mouth turns down, you can have these little muscles here relaxed, and the platysmal bands, which are these ones across the neck, which can soften the neck, soften these lines, and improve the line of the jaw. Botox is incredibly safe. There have been literally millions, and it definitely doesn't hurt as much as I thought. There have been literally millions of treatments around the world, and there are very few problems with Botox. It wears off completely. Botox wears off completely. Dermal fillers, hyaluronic acid fillers, they don't wear off completely all of the time. They tend to break down, but Botox, your body just wears out. So Botox works by switching off the communication between the muscle and the nerve. When your nervous system tells your muscles to move, it does that by releasing a chemical called acetylcholine from the nerve to the muscle. So Botox works by switching off that release of acetylcholine, so that then that muscle cannot move, because without that communication between the nerve and the muscle, there can be no movement. So the muscles that we tend to treat, this is the procerus muscle, and these are the corrugators along here. Those muscles work together to form your frown, and Botox we inject here along those lines, along those muscles, to reduce those lines and reduce that movement. If you have lines here that are very deep, that have been there for a long time, or when you completely relax, if those lines remain, those lines might not go with Botox. They'll gently reduce over time, but they won't go completely. And if you're being told that they will go with Botox, it's not true. What will happen is those muscles will reduce their movement or stop their movement, so the lines won't get any worse, but they won't necessarily go completely, but they can soften. These lines across here, these are caused by the frontalis, which is this it's like a very thin muscle that branches off in two little directions. The only job that those muscles have, the frontalis muscles, the only job that they have is to lift the eyebrows. So when you have Botox up here, it stops that muscle movement, but also what can happen if it is too low is that those eyebrows can drop. So the first part of the Botox treatment goes between the eyebrows and along the corrugator muscles, those ones, and the second part of it tends to be the frontalis. If you have the injections quite high up, you can have a lift. You can't always get a lift. Sometimes if the injections are put right in the middle, you can get something called a Mephisto brow or a spot brow, which can lift up, and I've seen that happen. Luckily, it's never happened to any of my patients, because I'm pretty careful with my product placement, because I assess every muscle and every movement really carefully. And then usually the last part of the treatment is to have the orbicularis oculi muscles, which are the eye. This is actually a sphincter muscle which closes the eye. Here you tend to form your crow's feet, and they tend to be these transverse lines that come out there. Botox stops that movement because you just tend to have that area treated and they soften. Again, if you have those muscles there and you're completely at rest, those wrinkles there, sorry, and you're completely at rest, they're not going to go with Botox. The movement will stop, so they won't get worse, and they might soften, but they'll still be there when you're at rest. So you have to come in and have a treatment with realistic expectations about what we can achieve with your particular face, with your particular history, and with your particular skin. So all of the treatments with Botox are done with a needle and syringe. So you have injection points, and injections, as you know, can hurt. The needle is incredibly fine, 30 or 32 gauge, so it's really tiny, really tiny. Even smaller than the injections that we use, the needles that we use to inject babies' immunisations, for example. Really small. They can be a bit stingy because we're putting a liquid into the skin and into the muscle. And because you're having an injection, you can bruise. Some people get a headache after they've had Botox, and some people don't. And some people can have some little pink marks, some people have inflammation, some people can have itching. Everybody is very different. So the most important thing is to have a really good, thorough consultation with a healthcare practitioner. And we have to go through everything in your history with your health, with your aesthetic treatments, because we really need to know that you're safe to have the treatment, that you're well. We need to identify any possible medical reasons that you may have that may mean you aren't suitable to have a Botox treatment. There are things like myasthenia gravis and Eaton-Lambert syndrome, which affect the nerve and muscles. So you shouldn't have a Botox treatment if you have those issues. If you have an active infection in the treatment area, it could make the infection progress. If you're having any investigations for any health conditions, and obviously if you're pregnant or breastfeeding, you mustn't have any treatments with Botox. What else can I say? Once you've had your Botox treatment, it takes 3 to 4 days to start to work and about 10 to 14 days before it reaches its full effect. And usually after 14 days, you'd have a review with your practitioner. It's really important to pick your practitioner very carefully to make sure they're very well educated in Botox and identifying any potential complications with any aesthetic treatments. So you need to check that they've been trained, that they've got proper insurance, and that their premises are secure. And it's never really a good idea to have a Botox treatment in somebody's private home or in a hairdressing salon, for example. And I certainly wouldn't want to go to anybody who wasn't a healthcare professional. Botox lasts for about 3 to 4 months, and gradually the terminal end of the nerves will start to reproduce the acetylcholine, which then starts to communicate with the muscle, and then you'll start to see movement come back where you've had your treatment. I haven't seen any questions come up in my chat, so I will leave it all there. And if you do watch this video and if you do have any questions, feel free to drop me a line anytime.